So, as Miss Andrea said, today we are going to be learning about public health, okay, and what it means to be a public health scientist. And you guys gave amazing answers already. Somebody said that it's looking at groups of people, maybe figuring out what bacteria are making people sick, right? These are all fantastic answers, and we're going to be finding out more about exactly what a public health scientist does today.
Let's talk first about what is public health. So you guys gave 3 amazing answers. I literally couldn't ask for any more than 3. Those were amazing answers. So public health, it's a little bit different from going to the doctor, right? So the doctor helps just one person. But public health workers, like you guys said, they help entire communities, entire populations. Yeah, so it's like being a doctor for like a whole group of people instead of just one person. So they study a lot of important things to make sure, like, for example, everybody has clean water to drink, or giving people vaccines to prevent like diseases too. Like kind of the idea that Jade was showing earlier with the bacteria. But vaccines are for viruses, but similar thing. And they make sure our food is safe to eat too, because you don't want to eat all the gross expired stuff, right? So by doing this, they want to help prevent people from getting sick. So they want all of us to be healthy together. Since public health workers are a type of scientist, they have to do something very important, which is making a hypothesis. Does anybody remember what hypothesis means?
Hypothesis. Luca?
It's like a guess.
Like a guess, yeah. And then the Kai also, you can add on the Kai. Go ahead.
Test your hypothesis out.
To test. Ooh, to test it out. So Luca put the first half. It's going to be like a guess. And then the Kai put the second half where you're trying to test it out, right? You're trying to experiment a hypothesis. So great job, guys. So since public health workers are a type of scientist, they need to make hypotheses also.
So, what's a public health question that you guys have? Do you have a question? Is there something that you've wondered about how people stay healthy or how scientists help communities? You guys have any questions? Dakai?
Okay, my question is, how do people get sick?
That's a great question. How do people get sick? Anybody else has a question? Luca?
How does that type of scientist, if a lot of people need help fast, like if some people really need help fast?
Okay. It's a great question.
Wow. It's like who to prioritize and who not to prioritize.
Yeah, you know what, Luca? That's a really great question. And we're going to be doing an activity later today that's going to talk a little bit about that issue. So that's a fantastic, I mean, they're both fantastic questions. But that's really good because we're going to talk a little bit more about that today. What happens if there's a group of people that need help really fast? What do we do? Okay. How do we help them? And so that's a fantastic question, and we're going to explore. Now we have more demographic data, so more information about the types or the number of people that live in each area. Now these figures look slightly different. So we're still looking at one figure equaling 100 sick people, but this time the figures look a little bit different. What kind of figures do you guys see here on the map? Let's see, Giovanna.
There is people in wheelchairs. There is people who are gonna have a baby.
this map is more representative of the types of people that we'll see walking around, right? Because not everybody looks the same. Everybody looks different, okay? So this map is representative of all the different types of people that you would see around Los Angeles, right? People with different skin colors, people of different heights, different sizes, babies, pregnant people, people who have walking sticks, people in wheelchairs, okay? So this map is representative of all different types of people, okay? So yes. Now, I want you to keep that in mind, okay? Look at the map, maybe a little bit more carefully now, because not only are you looking at the number of people, but now you have diverse people, right? More representative of the types of people in Los Angeles. And now I want you to think again, where would you build your hospital, okay? This one's a little bit more thought-provoking, right? Some more thought goes into it because we're not just looking at the number of people, but we're looking at different types of people, okay? So based on that, where did you guys decide to build your hospital?
I decided to build my hospital in the central Los Angeles because it's called the central for a reason. It's because it's the middle. And then if it's in the middle, then everybody could just meet up at the middle and then we could save everybody and nobody has to be left out.
Yeah, thanks for that, Alison, right? If we build it in central Los Angeles, it might be easy for people to travel in from all different areas of LA, right? Versus I put it all the way down in the gateway cities, it might be really hard if somebody's sick in Santa Clarita Valley, right? To come all the way down. Thank you for that explanation. Ariana and Zelda, where did you decide to build your hospital?
I decided to put my hospital in Gateway City. True. Because there's a lot of people that are sick.
Well, a lot of people.
Cancer.
Okay. Dr. Fatimata wanted to come and talk to us last semester when we did epidemiology, but she wasn't able to. So she was like, Kelsey, I really want to come and talk to the kiddos this semester, right? So we had her during our public health week because guess what? Epidemiologists are kind of a type of public health worker, right? So she's a special type of public health scientist called an epidemiologist. Okay, and Dr. Fatimata is here today to talk about all of the cool things she does so she can inspire you to maybe become an epidemiologist.
I've heard that you talked about what an epidemiologist is last semester, and I do want to start with that. An epidemiologist is like a detective for health. So our job is to keep people from getting sick by figuring out why or where sickness comes from and how it spreads. So, for example, if you were at school one day, and let's imagine that lots of people in your school get a tummy ache, right? And we as an epidemiologist will get a phone call and we could come and try to figure out why. We could come and try to figure out why is it that a lot of people are having a stomach ache around the same time. Maybe it's because of something that they ate, right? Or maybe it's a germ that's going on around. And so our job will be to figure that out and then to stop wherever the source is and make sure that more people are not getting sick. And for those who are sick, that they get the right care. So that's one of the main goals of an epidemiologist. Now, I know that Kelsey has already talked about this and Andrea talked about this. I'm gonna ask you this question again. What are some of the ways that we can get sick? Anybody?
If somebody is sick and they are by you,
You have to see why they're sick.
That's right. That's my job, right? As an epidemiologist, like where it comes from. What do you think can make people sick? What are some of the ways that people can get sick, Takai?
Wash your hands.
That's right. So when you wash your hands, you'll probably, very good. Next slide, Kelsey. So if you wash your hands, you're likely to not get sick, right? And that is because when you wash your hand, right? You are eliminating at least the bacteria that you're getting exposed to. So some of the ways that people do get sick is through bacteria. Great answer. Okay, so that's why we wash our hands often, so we can get sick from a bacteria. And now bacteria can be good or bad. We can get sick, yes, we can get sick from the bad bacteria when we don't wash our hand and we get a bacteria that is harmful for us. But we can also have, right, like good bacteria, like the ones that are in your stomach, right, and help digest your food. Where do you think you can find an epidemiologist in your city?
In a lab?
In a lab? Yeah. Mm-hmm. Yeah. Very good. What else? Where else do you think? So that was a really great guess. In the lab. There are many other places where you can find an epidemiologist. So you can find them in the lab, like working at, like let's say a biotech company, a pharmaceutical company. Yes, okay. Oh my gosh. Or sometimes even in the lab at the university. Sometimes you'll find them also at a university, right? Working with other investigators or other public health folks. So for example, right now, I am working at the university. It's called the University of Southern California, USC. You can also find epidemiologists at hospitals. I remember Jade, you talked about the place where people go when they're sick, the hospital. Yes, when you go there, you can find also epidemiologists who are working very closely with doctors. So the doctors are the people that will talk to you when you're sick and you go to the hospital. But there's someone behind the scene doing the work, the research. That's an epidemiologist.